Okay.
Sister, hold the camera a little bit higher.
Good.
Oh, I can't.
Okay.
I can't hold it. I don't have anything to.
Wait, are we live?
Yes, we are. We're live on Facebook.
Okay, hello.
Hi, everyone.
Hello, everyone.
Are we really live? Do we know? Can
Yes.
someone respond and tell us that we're live? Or we are?
Okay, let's see.
Well, it says live in the Zoom screen, so let's.
Okay. Should we wait a couple seconds to see if people join us? Melissa, can you see?
Let me log in.
Yes, we are live already.
Oh, we are live. Okay. So I guess we won't wait. So I am so excited to be here with these three lovely ladies. And if you don't know me, I am Christine von Raesfeld. I am a patient advocate. And actually the reason why we're on here is because we're all in California and we are, self-isolating ourselves. And we wanted to come on and just let you know what we're doing, what we have in store for you guys in our fibromyalgia, lupus, and rare disease community. So basically, my friend Stannon, you'll know him from my social media, we decided in the midst of all of this to do this stupid thing and start a nonprofit. And so our nonprofit the focus is breaking down silos in healthcare, but until we can meet with other people person to person, we decided we're going to help the community. So we have launched this campaign that has now become national because we were actually on the news yesterday here in the Bay Area. And we are organizing people all over. We are asking a couple things. One, we know that some of you may have PPEs, which is personal protection equipment at your homes that may be excess and laying around. We do have first responders, we have healthcare people, and we also have grocery workers who need these supplies. So if you have extra laying around, let us know. On the People with Empathy page, we also are looking for people who are willing to make masks. We want to distribute them to the public, to infusion centers, again, the grocery stores, anyone that might need them. We've also found that putting a mask over an N95 mask is, stretching the life for some of our healthcare providers. So there is a form on our page where you can sign up. You can say if you have materials that you'd like people to pick up, if you have masks or sewing machine and you'd like to help us, fill out that form and we are going to start connecting you with your own community. So be patient, because if there is no one in your area at the time when you're reaching out, I am sure there will be. We are teaming up with nonprofits all over the place. So if you are a nonprofit and you're interested in helping us out, let us know. We are, again, working with LIMS and Support Fiber. So you guys, you want to talk about anything before we go on to whatever?
Well, you were just on the news.
Yeah. Yes. Do you want to introduce yourself and what People with Empathy is first, Christine, and then we could go introductions. So just in case for people watching.
I kind of felt like I did, didn't I? So it's a nonprofit where we basically, lately I've been traveling a lot and I've been going to different conferences in different spaces of healthcare. So I've been at Virtual Med, Precision Med, Pharma, ACR, whatever. We were there. And so we have noticed that in these industries and in these specific silos that people don't talk. And we also know that collaboration brings answers. And so we want to connect people who have empathy and who have the same purpose of making sure that patients' lives are better, and just kind of team up with those people. So you know that if you're working with us at People with Empathy, that it's an organization that that cares about our patient communities and that really wants to help. So again, if you're interested in joining us in our efforts, sponsoring us, we do need sponsorship, anything. It's something that will benefit all of us in the long run. And so I am one of the founders, and stand-in is my co-founder, although people have told us not to say co-founders because it makes it look like one of us is better than the other. But we all know who that is. No, I'm just kidding. Anyway, I've been cooped up too long. And we have a board member, Viz. She is an amazing person. I'm going to be posting her bio on our page later. And we will be posting right after this broadcast the link to how to get involved. If you want to look at it now and fill it out right now, it's www.peoplewithempathy.org. And again, I'm working with these amazing ladies who make things happen. So, I don't know. Melissa, you want to go next? Say who you are, because I'm not sure anyone knows who we are on People with Empathy.
Okay, I'm MelissaTalwar. I am the executive director of the Support Fibromyalgia Network. I'm also a board certified functional medicine health coach and was diagnosed with fibromyalgia, so that's why we're leading that group. Happy to be back from Washington, D.C. in our great trip. And then I am also the sanitation expert of our house. So I'm the one disinfecting everyone right now.
And if she sneezes, it's because she just sprayed Lysol everywhere. And then Estela?
Yes, I'll go next. So I'm Estela Mata. Hello, everyone, and welcome to this Facebook Live with all of us, with a group of 3 or 4 of us, but 3 amazing women that I am so privileged to work with and call friends. So I am one of the co-founders of Lupus for Lupus. I'm a caregiver, and 2 of my sisters have lupus, one of which you'll see her shortly. She'll introduce herself. But also I am a caregiver and I live with fibromyalgia. And like Melissa said, we just got back from DC. We were one of the last groups to be in DC and advocating on behalf of other fibromyalgia individuals that live with fibromyalgia. We're supporting and we're trying to do the best that we can to help support the community. So the lupus community, the fibromyalgia community, and just basically everyone in general within our community. So that's why we're working with people with empathy, because we know that we can make a difference in our community.
Juana is frozen, I think.
Okay. Hi, everyone. I'm Juana Mata, and like Estela said, I'm also one of the co-founders of Lupus for Lupus. I was diagnosed with lupus 10 years ago. So since then, my sister and I have been providing not only support to lupus patients, but also to their caregivers and loved ones. And I'm excited to be here live with these amazing ladies. So
we had an agenda, didn't we, guys? I'm like trying to go to my
Yes. So maybe first, before we get started, I know this is a very, very hard time for everyone. And I know one of the top of the list items, Christine, was about the COVID-19 and the impact that it's having in our communities, at our hospitals, and with our nurses, and also with the first responders. So I know you were talking about, you guys were just on the news I think last night, in regards to the work that we're trying to do and the efforts that we're trying to put out there to help not only our communities, but also our healthcare workers that are in the front lines that are dealing with the exposure of COVID-19 and the lack of supplies that are being given. And that goes across the board with first responders, healthcare providers, police officers, everyone, social workers. I know my sister is also a first responder as a social worker. So do you want to talk about maybe a little bit more in regards to what we're asking from our community members, those people that do have masks that can contribute?
So we do not want you rushing out to be a good citizen and flooding ERs and police departments trying to be, to be there and to help. So with that form that we have there, we are gonna pair you up, and we'll have people scheduling deliveries and pickups. And we will find places to donate and get them to the places that need them the most. So basically, it's filling out that form and putting in your location and what you're willing to do to help us. So if you are willing to sew masks, if you have excess supplies, that
I think we lost, can you guys hear her okay? Melissa, can you hear Christine okay? No, she got pixelated and I can't hear you, Christine.
oh, now?
Yes, you're good.
Okay. Where did you miss me? Do you know?
Almost at the beginning, where we don't want anyone to go out there and be driving and taking the supplies and getting exposed. We want them to connect and fill out the form.
Yeah, we want you to fill out the form. We will help connect you with people in your community. If you do have donations that you feel like you need to get rid of now, we recommend you call places, because some places are not accepting donations, but others are. So I know in our Bay Area, Stanford has an email specifically set up for COVID-19 supplies to be donated. Valley Medical has a phone number and a foundation set up to help. And what was the other one? And Kaiser Santa Clara, you can actually drop supplies at their ER. Don't leave your car, pull up, and someone from the ER will come get your bag. You just let them know you're there for a donation. So as we get these resources, we'll let you know. And if we find them out in your area, if you're happening to, you want to link up with people and either give supplies, make masks, or whatever it is, or even help just driving with us, let us know, and we'll make those connections. Again, I'm telling everyone to be patient because we are getting overwhelming responses from other states asking for help as well. So as soon as we pair up people in your area or in your close proximity, we will let you know. And we're working hard now, just connecting with organizations. And you'll see coming up in the next few days that other organizations will be sharing this. And we've already got the backing of one of our assemblymen, and I'm hoping to get other politicians on board as well.
Yeah, so baby, the two key things that we want to emphasize is do not go out there and get exposed. Do connect with people with empathy, fill out the form, let us know. And then people with empathy, Christine and Spandon will connect you to someone. So if you're local where I'm from Baldwin Park, then they will contact me and then we can make arrangements so you don't have to get exposed. Maybe leave things in front of your porch and we can pick them up. If you have sewing machines, we also are encouraging you to make masks. So also if you have that option of doing that, please do reach out to people with empathy. And the form is not, I'm thinking it's not too long or extensive, right, Christine?
It's literally a checkbox. You just say what you're willing to do, fill in your name and your contact information. Yeah. And then we'll get in touch with you and we'll go from there.
Yeah.
For those people who have a sewing machine and want to donate or start making the masks, is there a specific fabric that they need, or how are they going to get the fabric?
There are recommendations on the websites for what to use, and we're also finding that sari fabric, we put up a little link to NIH post that's used to screen water, and so it filters out a little more of the germs, because I guess Spandon can explain the scientific stuff. I'm sure Melissa probably might know how it works too, but not me. I just know that they're saying that fabric may help as well. So there are recommendations, and we'll put them again as well on the thing. But what they're looking for is heavy t-shirt material is what I think the CDC is recommending. If you guys, I can't remember. My brain is fried at this moment. Melissa? You.
I'll have to look it up. I know I was watching tutorials on the type of fabric because you don't want to let the droplets through and stuff like that. I know someone had asked me even about activated charcoal, like putting together a layer. So I guess I'm just trying to watch some of the people that have creative ideas to see if we can put stuff together.
So our hospital, one of the hospitals here in the Bay Area, actually put together what is it, like a tutorial on how to do the math. So we're going to be issuing their request because they are taking these masks from people. So we're going to just use their pattern. So, and if you look at the news story on our page, I think it's down there somewhere. There are links to that news story, and it'll tell you there as well, you know, some of the other stuff in there. So, but it'll give that list to the Valley, you know, Valley Med link to face masks.
Is there anything on there about bras?
I don't know, but so we've all seen this going around Facebook of people cutting their bras in half and making them into masks. Look at Juana. And so we are not sure. So if any of you have information, because we were talking about some of the bras that we all have quite a bit of padding, and we don't think that droplets could pass through any of that. I'll admit it.
Not the lace ones. The lace will not cover.
Lace, I guess. But if anyone knows, we are kind of curious because it does have a fit, and I don't know. You know, I mean, and it does depend, I guess, on your size, because I've been in the house way too long, you guys.
Yeah. So besides the people with empathy and connecting and looking for the material, so like Juana was asking them, all the information is going to be found on the website on People with Empathy. So you can find all that information there. Another thing that we were talking about is just connecting with each other. I know I put out a post yesterday in regards to physical, you know, the social connection versus physical connection. I know we're talking about the social distancing, and you know, we're trying to connect through social media. We want you to know that we are here for you. We're trying to do live streams. This is one of the reasons why we're doing this today, because you know, we're in different parts of California, and we want to make sure that you know that we are here for you, and that you know that you're not alone. So I know it's really hard at this time to be dealing with, you know, a chronic illness, to be, you know, not going out of your house a lot and trying to keep safe, like Melissa was saying, trying to make sure that those that live with you also take the precautions so they don't bring the germs back. So, you know, for me, it's been hard because it's been hard and it's been easy. It's been easy because I could work remotely, so I'm all set up at home, so that has not impacted me. My husband is in front of the lines. He works in healthcare, and he is, you know, dealing with patients that are sick. And so no matter how much precaution I take from not going out, it's kind of inevitable if he does get exposed for him to expose me. So we have set up like something in the garage, so just in case he does get exposed. But I know it's difficult. I try not to think about it. And one of the things that I want to encourage everyone to do is to stay positive. I know it's hard because you might be home alone and you might be dealing with mental health, maybe depression, anxiety, but know that it's okay to feel overwhelmed. It's okay to feel a little anxious. It's okay to cry. It's okay to feel that way because we're all feeling that way. And the first thing we want to do is accept and acknowledge that this is not easy for everyone, that this is a change that has impacted every single one of us. And it's okay not to be okay. And it's okay not to have everything in order. But do keep in mind that also that, you know, we do have that responsibility of taking care of each other. So as much as you miss, you know, connecting and being in social activities, do that socially, that social interaction, do it through social media like we're doing now. If you do feel that you need more help than just connecting with us through social media, you know, whether you have suicidal thoughts or any other things that you may want to talk about during this time, you know, there are hotlines, and I think it'll be good, Christine, if we can put those also like the suicide hotline and stuff on people with empathy, because a lot of people may be in need of those numbers. Domestic violence numbers as well, like all the things. We are here for you. Let us know how we can help you. And I just wanted to share that with everyone, because I have seen a lot of social media, and one of the things that I encourage others to do, people that have these platforms, don't, and I shouldn't say don't, because we're all responsible for our actions, but a lot of social media influencers that I've noticed have been taking shots and inviting others to take shots with them from home. And, they're intoxicated, and, you don't know what the other person's going through. You don't know if they already have, in their life or been exposed to alcoholism or addiction. So don't encourage that kind of behavior. I've gone on to a couple and I've told them, we love you, but please don't continue taking shots. They're intoxicated and they're like bringing other people in and taking shots with them. And people want that 2 minute of fame, and they're taking these shots, and it's not good for anyone, really. So I just wanted to shout out, know that we're here, but connect very wisely and be kind to each other. And that's my 2 cents. I'll let you guys.
I am but but I do want to say, in addition to that, we're supposed to be secluded, and you're drinking alone. And if you drink too much and there is no one there, so just please be responsible, be safe is what we really say, right?
Well, that's the important thing. People have to think about, not only how they're feeling, but how others are feeling. And like Estela said, that, doing things irresponsibly on social media, if we don't know what other people are going through, we don't know what they're thinking, and that could actually affect them more than it can help them. So we encourage everyone to, again, be safe, and also be mindful of what you're sharing with others through any social media. And as for me, I as everyone knows, I do have lupus, and one of the medications that I am taking is the Plaquenil or hydrochloroquine, the medication that everyone's talking about, that they might be using, that they're doing clinical trials for the coronavirus 19. I encourage everyone to, or every lupus patient to don't double their dosage. That might not even help. Continue taking your medication, and if you're thinking about taking even more, don't do that. You have to first talk to your medical provider. You talk to your rheumatologist or your doctor that will let you know whether you can or cannot. We just don't double any dose for any medication. And about the shortages, make sure that you do fill up your prescription at least 3 months. And I know that I have also heard that there's many people who have not been able to fill up their prescription. So, check your local or different pharmacies, because you want to make sure, as a lupus patient, if we don't take Plaquenil or hydrochloroquine, we can go through a flare. So just make sure that you do, make sure that you have your prescription Plaquenil, and don't forget to wash your hands. Don't touch your face. That's something that I'm always used to, touching my face. But we just have to take we have to be extra careful. For me, I continue to work because I am considered a first responder. So I have to take extra precautions because I do have to go visit families. I have to still be around coworkers. So we have to be extra careful and just be mindful of others as well. So I encourage everyone to stay calm. And for those who do not have lupus and who are not, do not have a prescription of Plaquenil, please do not go out and buy Plaquenil, because that might not be good for you. It might not do anything to you, or it might even hurt you. So I encourage everyone to first talk to the doctor before they start any medication.
So while we're on Plaquenil, I used to be on Plaquenil. I am no longer on it because it caused eye damage. So I want you to know, this is anti-malarial. It's not a drug to mess around with. It's not one that they do this on your weight and, specifics to you. So do not increase dosages. What people don't know is those of us who have or who do take Plaquenil, you have to go through eye exams. You have to have a full screening, and not by an ophthalmologist. It's an ophthalmologist that you have to have it done by. They take pictures of the back of your eye. This is a serious thing. And we've already seen deaths of people taking it when they don't need it. So you just need to be careful. It's not
10 years. I have been taking it for 10 years. It hasn't, I haven't had any problems with my vision as far as the toxicity in my eyes, but I do get my eyes checked every 6 months. So I do please encourage everyone not to take the medication if you don't need it. It has to be prescribed by your rheumatologist or your primary doctor. You can't just go out and buy it and think that that's going to protect you from, the coronavirus. So please, I encourage everyone to stay away from it if you don't need it and if it's not prescribed to you.
And don't up your dosage if you start to show signs of anything. Worst thing you can do. So if you're showing signs of anything. Right.
Well, the dosage of Plaquenil is it's prescribed and it goes by your weight. So you wouldn't be able to know unless your doctor tells you how much of, or the dosage that you have to take. So you have to be very careful. I mean, you don't want to just take any medication because you think it's going to help you. You have to have the prescription.
Anything, Melissa, from you on Plaquenil?
Well, I also wanted to just mention, because I've seen some people talk about fibromyalgia and not have to worry. I've just been telling people to follow what our autoimmune friends are doing for protocol right now, because even though fibromyalgia is not classified as an autoimmune condition, we just don't have enough research yet. It's found so much. So I was actually going to do a separate video on breaking down just common sense practices for fibromyalgia specifically, because I am seeing some fibromyalgia people living with fibromyalgia who are getting sick, and it's really impossible to tell right now between the different flus and COVID-19.
I did want to bring up, I don't know how much time we have, but before it gets to anything else, we are working on proclamations. So for the month of May, so while you are sitting at home in your rooms, you can do some work for us. We have on People with Empathy, we have a template that can be adjusted to you, and you put your organization, whatever you want. We just want as many cities throughout the United States to have their cities issue proclamations for fibromyalgia, for lupus, and it actually also is Mental Health Awareness Month in May as well. So
yeah, and I'm glad you touched on that, Christine. I think what we're going to be doing is, Melissa, just correct me if I'm wrong. I think we're going to be putting out a video, right? So we're going to actually be speaking to people on how to submit a proclamation, how to go about contacting your mayor and the city clerk and getting dates as to when we should submit it. We do want to encourage every one of you, whether you have fibromyalgia, lupus, or living with mental health, let us know. We will help you. We want to encourage you to get a proclamation from each city. And really what a proclamation really is just stating is that your city is declaring that month, the month of May, which would be 2020, as Lupus Awareness Month in the city, or fibromyalgia in the city, or mental health. So we want to encourage you guys, let's make our voices heard. We are in this together. The more proclamations we get out there, the better it is, because what it is we're trying to bring awareness to our communities. Like Melissa said, there's not a lot of studies known about fibromyalgia, not a lot of research. It's classified differently everywhere. My daughter lives with fibromyalgia, and so do I, and my sister, and my aunt, and so many of my friends. And one of the things is it's the unknown. We don't know if it's ever maybe in the future. Who knows? It's maybe an autoimmune. we don't know, and that's the problem. So we want to bring more awareness. There are so many people that live with fibromyalgia, and we want to make sure that everyone gets supported. And living with a chronic illness, actually increases, your mental health and all the depression and anxiety, just dealing with a chronic illness itself, let alone the situation we're in right now. So we want to highlight also mental health, what is going on with our kids, our seniors. My daughter is a senior. She lives with fibromyalgia. Is she going to have a graduation? There are so many things that kids are going through right now. I know our congresswoman had mental health, and there's mental health clubs in our high schools, in our junior high schools. And there were so many kids that were looking forward and connecting with each other and talking about mental health. Who's connecting with them now? Nobody is. So we need to figure out a way to connect with our youth, connect with our students, and make sure that they're doing okay, because this is also a hard time. So bringing awareness to mental health during May. Obviously, we want you to do it the whole year, but during May is Awareness Month for lupus, fibromyalgia, and mental health. 3 things we are very passionate about, the 4 of us and our organizations, and we want you to partner with us. So go to People with Empathy. You'll find some templates there, but also Melissa through Support Fibro and us through Looms for Lupus will be posting information in regards to when we're doing the Facebook Live or video in regards to fibromyalgia and how to submit. And if your cities are still not active and we are not going to be getting the proclamations at the city clerk or during their meetings, during their city hall meetings, what we can do, we can get them mailed to us, and then you guys can take, or to you, and then you can take the picture and then we can post it on social media. So we want to make sure that we're still actively working together and supporting each other during these times.
So mental health, really quick, just to touch on it again, really quick. I am also a board member for DBSA California, which is the Depression Bipolar Support Alliance. It is a peer-run support network. And so just so you all know, my niece will be taking over their social media next week. So they will have a platform on Instagram, Facebook, and Twitter. Instagram, they are reaching out more to the teenagers and the young adults and that crowd. And Facebook, they'll be publishing articles about mental health and awareness and the advocacy efforts that we're doing. And then Twitter is Twitter. So look out for that. It's DBSA California, and it's a great organization. So we're just teaming with everybody at this point.
Yeah, because we're in this together. Melissa, do you want to give some tips? I know you're huge with going out and gardening. I know that you're very passionate about doing that. So I don't know if you want to talk a little bit about what you're doing and what you recommend other people to do during these times.
Yeah, I have been growing food. So as soon as I got back from DC, because luckily I guess I had stocked a little bit of everything before I left, but I ran over to the nursery and got a lot of dirt and plants, especially a lot of herbs, because you can use that for medicinal purposes sometimes, or steep it in teas. So I got a bunch of plants. Once it stops raining, I'll get those in the ground, and it gives me an outlet and something I can do. I've been wanting to expand my garden anyway, but we were on the road so much that I didn't get a chance to do that. So now I'm here. So that's what we're just doing and just enjoying the time. I think I've been used to staying at home for quite a bit of my life. So now it's just trying to make sure we provide support for other people and what they need. I know we did throw it out there, if other support groups who have in-person groups need help transitioning online, we can definitely help them through stuff like Zoom, so that way they don't have to stop their support group. So these are things that we are just trying to help with right now.
And DBSA is going to start having online support groups as well for their mental health with with everything happening. So look out for notifications about that for different support groups throughout California where you can go virtual like us.
Yeah, and that's great that you guys are bringing that up, because we had to do our support group virtually this month of March, and one of the things that we were having difficulty. I think Facebook has changed the way they do the Facebook Live, so we couldn't get that working. But now, thanks to Zoom, we're able to do this. So I'm so glad and grateful, not only that we have the technology, but that we also have people that are going to continue to connect with each other, because and just because we do it virtually doesn't mean you have to be on camera. You can also dial in. So if you don't want to be seen or on social media, then we can also just connect via phone. But yes, it's we're all doing this virtually. So I'm so excited that we're also going to be posting information in regards to our support group, where we had a little bit of confusion because we do Spanish and English support groups. So we had people connecting at different times, and they're like, I don't understand. So we're doing our Facebook Live in Spanish from 8 a.m. to 9 a.m. on the second Saturday of the month, and then from 9 a.m. to 10 a.m. in English. So that way we don't have to be translating. But we want to make sure that everyone in the community feels that they do have support, that we continue to stay connected during these times.
And more than lupus, Kelly has her online support group on Mondays at 9 a.m. And Melissa has some amazing videos all the time on her page, just talking to different people and different things. So make sure you're following her page and their page, and find out what we're all doing. And we're going to keep connecting with each other because we actually do like each other. Although I think sometimes they want to get rid of me, but
no way. I mean, we definitely have to do the proclamation video. I know Estela and Juana explained a little bit to us while we were in Washington, D.C., and I apologize. I think the rest of the team heard you. I was so preoccupied with making sure everything was disinfected for everyone. And we had tour groups coming into the hotel. So I was like, do I need to spray the room with Lysol? So I just was like, I don't remember anything that they said. My lizard brain was like, disinfect. So yes, we'll need a video.
You were spraying people down as they walked by you. Melissa?
I think she wanted to do that. She didn't typically do that. She wanted to.
Just ask Suzanne. I disinfected the whole entire room for us, when starting from the door handle, like I had an alcohol spray bottle ready to go. So yeah.
Yeah.
Supplies. Melissa's hoarding everything.
No. Well,
she is not.
No, we had to be extra cautious because we were in DC like the week before. We were one of the last people that were meeting with our legislators and their staffers. Our last appointment was at 4:00, and the last appointment or meetings that they were going to take were 5 p.m. So we were literally there, and we needed to make sure that we took all the precautions. So Melissa was such a trooper with that. She was making sure people were not touching. We were doing jazz hands, and trying not to, get too close to each other. And it all worked out. So yeah, she was busy doing that. But we did highlight a couple of things, and we do want to connect with everyone in the community. But should we go? I'm going to go. I see people that are logged in. I don't know if we want to say hi to them.
Oh yeah, I don't.
Yeah. I know Jim Murray, I believe, is on there. Bidge, Spandon, Mary Bea, Kevin herself from the Arthritis Foundation of America is on, and Tim, and I believe Mary was saying that she was able to get her prescription for Plaquenil, so that's amazing. That's one of the things that we talked about is, even though before it came out in the news about the Plaquenil, we were saying, please go to your pharmacy and get your prescriptions, because we know how important it is for you to be out. To not be out of your prescription and to not be out and getting those prescriptions filled. So I'm glad that you are taking it. And she said she's been taking it for 10 years as well. We just want to make sure that, everyone's taken care of. But again, if your pharmacy doesn't have it, if they can't refill your prescription, whether it's Plaquenil or any other prescription that you're on that you need to be taking, make sure, don't wait till the last minute. You can contact other pharmacies around the area, contact your provider, because I'm sure that, you know, you could probably find some sort of medication out there. So,
and please mention to these pharmacists that you have lupus.
Yes.
Don't try to just you know, because I've heard from some people that they're requiring codes. I've heard other things that they're only selling to hospitals. So please inform them that you are a patient, you've been on it for a while, or whatever your situation is.
Well, I believe you do have to have a prescription to get it. I mean, I was able, yeah, you have to have the prescription. And if your pharmacy doesn't have it, and if you choose to go to another pharmacy, then you have to take your prescription with it. I mean, to that other pharmacy, they won't just give you the medication just because you have lupus. There's a lot of people with lupus who do not take the medication. And I mean, we want to make sure that whoever, you know, needs it, there's medication for those people that need it. So I know that Mary Bea said that she has a toxic optic and toxicity in her eye. So I just want to, you know, let you know that, you know, just make sure that you never miss your appointments with your ophthalmologist. It is very important because that's one thing that you don't want. You don't want the toxicity to, you know, to continue to get worse. And just be careful.
With any other comments, Estela? Because I can't see and I'm afraid to touch anything on my screen.
I was just agreeing, you know, with, I have a tendency of touching my face. So if you see me fidget, it's because I'm trying to keep my hands busy. I touched my face twice since we've been on live, one on my nose and on my chin. So I've not contacted my eyes yet, but you know, I have that bad habit. So I'm trying to clasp and then to sit on my hand. Yeah, I'm sitting on my hand.
I did a whole TV interview with my hands like this.
Yeah, because we don't want to, you know, keep touching our face. But in regards to, you know, I know we talked about social media and sharing can sometimes be, you know, something that we want to do. We see something that's like, oh my gosh, this looks like it's very important. Let's share it. Please don't share information that is not accurate. First look into it before you share anything from the CDC, the NIH. Those are credible. You know, there are so many people that are just sharing misinformation, and you know, every time I see it, like, it just saddens me because there are so many people that can be vulnerable and believe what they see because they know you, or they think that you wouldn't share something. So please, if you're not doing it intentionally, like, just look at the stuff before you share it. You know, we don't want to get or give the wrong information to anyone. So anything from the CDC is great. I think the CDC is actually, and I'll share the information with you, Christine, so you could put it on social media, and we'll put it in our platforms too. The CDC is actually going to have a COVID-19, I believe it's a webinar or a phone call tomorrow live. And this was going to be specifically on chronic illnesses or patients that are, you know, immunosuppressed or that have chronic conditions. So that's very, very important. Those are the sites that you want to get your information from. So we're going to be sharing that information. I just heard about that. I know that, you know, if there are people out there that still don't have the information, if you do want information, go to those sites, and if we could share them maybe on this post, it would be great.
On the page, the reliable and credible sources that we have. But while we're on that, please don't copy and paste, because if a researcher or doctor has some public information, they will post it publicly, and then you can share from their page. But when we copy and paste, people add things in there that sometimes aren't true, and then we're spreading more misinformation. So please, credible sources only. It's the only way we're going to avoid this hysteria that's happening, and get the facts out there to people. So, you know, Melissa, you're so quiet.
I'm just listening and absorbing and trying not to crash our system. Yeah, I agree. And just again, it's like, I know, stay home and enjoy the time with your family, or do these types of virtual interactions with some friends, to stay connected. But we really definitely need to take care of ourselves right now.
And this face-to-face video, just so you all know, I have been connecting with rare disease patients all over the world lately. And so it's just the face-to-face conversations, even though we're not, here in person, it's a whole lot better than just talking on the phone. And so I have another call scheduled Saturday night with David Ross. He's over in the UK. So, I think take this opportunity to get to know other patients and other people who are dealing with the same things. And you know what? We don't all have to have the same diseases, but we deal with the same symptoms. And right now, everyone in California is feeling what it's like to be a chronic illness patient. They're at home, they can't work, they're afraid of whose germs are in their house. This is how we live every day. So, I just want people to think about that. We've had people tell us like, oh, you guys have amazing lives. This is our reality most of the time. So keep that in mind and be kind to people and be nice to them, because you don't know where someone is mentally, and what you say could push someone over the edge in this time. And I know, you guys know, I had a mental breakdown just like the other week, and I'm getting by, but that connection is important. And even if other people don't understand it, those of us in this space, in this chronic illness, rare disease space, regardless of our condition, we connect on a different level and use that connection. You're not alone. You have a purpose. You're here for a reason. Help us with our awareness campaigns while you're sitting there doing nothing. Help us sew. Do something, because we all have a purpose here. We just need to find it.
And that's what people with empathy is about. It's about being empathetic. It's about caring for each other. It's about being kind to each other and letting everyone know that we are in this together and that you're not alone.
Rob, more than anything, just being nice and staying positive and not making negative comments towards other people, because like Christine said, we don't know what the other person is going through. So we have to be respectful. We're all different. And like Christine said, as a lupus patient and other conditions, we have been going through this for a very long time. We have to stay away from people, not because we want to stay away, but because we have been going through this, and we're scared to catch or get close to anybody that's sick that can, harm us, not in a bad way. So we just want everyone to understand that, and that we all have to be kind to each other, respect each other, and remember, we are all in this together. And I'm gonna have to disconnect. So I'm just gonna tell everyone, stay positive. Let's just continue to be respectful. Let's connect with each other. Make sure that you wash your hands, don't touch your face. Oh, I always touch my face, but it was great being with you ladies online, and I have to disconnect now. Okay?
Bye.
Love you. Bye.
So, do you guys have anything left? What time is it? We're at 4:52.
Yeah, 4:52. So Standen was saying don't hoard paper. So that was actually a true reality for me. I was down to my last 5 rolls of toilet paper. I don't think my sister realized that she's still on. I know. I'm like, I don't know that she. Those are the things that happen with technology. But I was down to my last 5 rolls of toilet paper.
I saw that meme about someone who took it into their bathroom, right?
Oh my God.
I didn't think it was real, but they had the picture. Like she actually took the laptop into the bathroom with her, sat on the toilet. So just remember, you're not used to video calls. You are on video.
You know, I saw that and I had to watch it a couple of times. So, and I thought, what did I miss? Right? Then I looked like the third time. I'm like, oh my gosh, what happened? And I thought, wait a minute, why? I'm sure she didn't post it. Why were the people not nice and kind enough?
I was hoping you guys would not post me going to the bathroom. Please don't eat it.
We wouldn't do that.
Go to the bathroom.
Yeah, but yeah, that's one of the things that have been going on. But yeah, the hoarding the paper, I mean the toilet paper, hoarding everything else, you know, please don't do that. There are so many people, you know, that were in need. I know that, you know, there were elderly going to the markets and they kept going for several days because they couldn't find the stuff that they needed. And you know, for us, we were lucky. My daughter, you know, I was working from home, so it's not like I could go work and stay in line for an hour. But that was another crazy thing. My daughter went 3 days in a row, and then she finally got toilet paper for us, which, you know, I don't know why we let it go down to 5 rolls, but, you know, there are 3 women in this house, so we needed some toilet paper. So we did get Kleenex just in case, but that was the reality of, hey, she needs to go get some toilet paper, and we finally got some. But also look out for your neighbors. You know, find out if your neighbors are there.
Can I say on the toilet paper issue, I just want people to know that there are some of us on fixed budgets. So you all know I'm on disability. I do everything pretty much as a volunteer, and I don't have the cash laying around to stock up on supplies. And neither do most senior citizens or people living on disability. So when you are hoarding these supplies, you're also taking away from those of us who can't afford to build up a stockpile of things. So, and every time, like you said, 4 or 5 times of a senior citizen going into a store to try to find toilet paper is now exposing them every time. So please, you know, I mean, we have here in Northern California, we have limits. It's literally, it says 1 thing of toilet paper at all these stores. So, you know, think of those people that don't have money, because we're really struggling here. And, you know, I don't know. So if anyone wants to send me toilet paper, no, I'm just kidding.
Yeah, and report those people that are selling the water, the toilet paper, and all that, you know, at an extra high price. You know, it's illegal to do that. So there are ways to report those people that are doing that. But before we finish our hour, I don't know if we're going to be here for an hour, if we were planning on doing this till 5, but it's 4:56. And before we end, I do want to acknowledge Melissa, because Melissa, one of the things that got canceled because of the COVID-19 was Melissa's was going to be honored, and I know we missed it. Do you want to talk about what your Women of the Year for the city, for what city, and what it was that you were going to be accepting, if you don't mind sharing with everyone?
Yeah. Oh, I mean, it got postponed, but it's Assembly Member Chris Holden, so woman of Sierra Madre, so the city of Sierra Madre. So I'm just thrilled and excited, because in the bio it talks about fibromyalgia. It's perfect exposure to get it out there more. So unfortunately they canceled the event and postponed it till later, and we had a lot of events planned, right? Our in-person stuff that we are still on hold. I don't know if I'll be able to do any of the tour. Luckily, the grant people have decided to extend our grant, thankfully, because I wrote them, I'm like, do I have to return the money? I don't know how this works. So I think luckily we're just postponing. Maybe it'll roll into 2021, but hopefully we'll get this going. And yes, just like Christine said, and Estela, please be kind to each other. I have been to the store and there's no toilet paper, even with limits. And I see people, the seniors and immune compromised and disabled, like with trying to get in and trying to get their stuff that they need. So just be kind to each other.
Honor the senior hours and the immunocompromised hours. And if you are healthy, stay out of the store during those hours and let those people get their supplies without everything being contaminated yet. Because usually those hours are first thing in the morning. It's when they've cleaned the stores. So let them have that time. And please remember that 6 feet of social distancing. And, I don't know. That's all I've got.
And don't sneeze on people, okay?
This is the right way to sneeze or cover yourself. Yeah. So the couple of highlights that we discussed, just to summarize, was connect with people with empathy.com, follow them, and we are all working together. Right now we're trying to get volunteers and see if we can get some masks for the people that are in the front lines that are needing these supplies. If you have donations, fill out the form, and also if you are interested in working with us and getting proclamations for your city, please let us know. That's for lupus, fibromyalgia, and mental health for the month of May. I know it seems like it's far from now, but we will be providing information on how to do that. And then third, just be safe, be kind, and know that you're not alone.
Oh, wait. All of our events that we did have planned, golf tournaments, we have a symposium with GSK on how lupus affects the minority community. We have 2 more, the Asian American and the Bay Area, as soon as we are free. And then we'll go down to LA, and Looms is going to have a mental health or a health fair at some point once we are released. And so then we'll continue our in-person when we can. Yeah,
so for right now, we have not canceled or rescheduled our May lupus, fibromyalgia, and mental health wellness event. I am actually in contact with our congresswoman to see, what to do if we need to reschedule it. I know with the news changes every day, so we're looking at a contingency plan. So we'll keep you guys posted once I get more information. But do look into our social media, follow us, because one of the things that we are sharing is the different ways on keeping active and just staying connected with each other. And I don't mean just Looms for Lupus. I mean follow Christine, follow Melissa, follow Support Fibro, people with empathy, because we're all in this together. We're all working together. We want you to know that there's no, we're the West Coast. We need to support each other. We need to work together and uplift each other and empower each other during these times and anytime, and that's one of the reasons why we love working with you, Christine, and with you, Melissa, is because we know that there's no competition. We know that we support each other. We know that, we encourage and empower to continue giving back to the community. It's not for us. Everything that we do it for everyone else. We don't get paid. None of us get paid for this. We do it willingly, and we want you to know that we do it from the bottom of our hearts, and we do it because we're really empathetic. This is what it's about. We know, we feel what you're feeling. We are dealing with the same things you're dealing with, and we are doing this because we wanted to make a difference. So, I know I'm just talking too much now, so I'll just stop. I was just supposed to just summarize. Take me up tonight.
Well, I have nothing else to say other than make sure you follow all of us on social media. And in that, I am adding Kelly at More Than Lupus, because I am a board member there. So make sure you're following More Than Lupus. Make sure you're following Depression Bipolar Support Alliance. And I'm also an advisor for Health Advocacy Summit. So if you are
We can't hear you, Christine. Okay. Melissa's like, yeah, now I can hear you.
I forgot what I was saying now.
Health advocacy.
Oh, and Health Advocacy Summit. So if you are between the ages of 13 and 30, you want to get into advocacy, all of that, follow them as well. So I'm one of their advisors, so I got to push everybody. And rare disease. I don't know. Might as well throw everything in, right? So I love you guys. Melissa, anything else?
Just love all of you. Please take care. Stay healthy. Don't want me to come over with all my like disinfectant stuff.
I want Melissa to come over with all her disinfectants.
Or my glutathione like pack of all the science.
I was gonna say, now we're getting too nerdy. I can't, Melissa.
No, I was saying drink your water.
Yeah.
Stay hydrated. But no, we would love to have Melissa around. She could be our nerdy, and she could also keep us safe from all the germs. And feed us delicious vegetables, because when she posts us, I'm like, oh, that cucumber looks so delicious, or that tomato looks so bright red. Like everything she posts, I'm always like looking on, and I'm like, I can't do that. But so just I think we should probably finish up. I think Kevin just said thank you. Kevin Purcell from Arthritis Foundation of America just said thank you for great live chat. Thank you for doing that. So I'm so excited. Please share. The Arthritis Foundation of America. I know there's a lot of people that live with rheumatoid arthritis and that are also taking the Plaquenil that are getting impacted. So please share. And also just take care of each other. That's what we need to do.
We need to do this all the time.
Every day.
If you want to join us, tell us in our comments if you want us to do it.
We need Melissa. We need her tech savviness. Melissa, we need you.
Just show up in your PJs and we'll be fine. By the time our hair, I'll be gray and purple soon.
Right. Yeah. The eyelashes are going to fall off in a little bit. So.
Yeah. Okay. Well, thank you guys. Thank you, Christine, for bringing us live. Thank you, Melissa, for your techie skills. And let us know if you need anything else from us. We're here for you.
And we'll post the link. So.
Yes.
Bye.
Bye.